So, okay, so we're going to get started again. I'm Diane Riley, Executive Director of SHA, Cassondra Warney, Senior Program Manager of CSH, and we work in New Jersey together a lot on supportive housing. And supportive housing, I just want to say a few words about it so people understand what it is. It is a sort of philosophy or model where we believe that people, no matter what barriers, can live independent, healthy lives as independently as possible in the community with the right kind of design services for them. And supportive housing is used for a variety of populations, people who are experiencing homelessness, intellectual and developmental disabilities, people with mental health addiction challenges, people who are aging, who are physically challenged, veterans, all kinds. And, you know, people aren't just one thing, right? They aren't just someone with a physical challenge. They could be someone who is a veteran with a physical challenge, or someone with mental health and intellectual and developmental disabilities, a variety. That's why it's so important to design services that are person-centered. Supportive housing, obviously, given those components, it's not the easiest thing to create. You need capital funds to build that affordability into a development. You need sometimes operating funds where a person can have a voucher or rental assistance so they can pay a small amount of even that affordable rent. But the developer and the people who own the building, they get the full amount of the rent so they can maintain it properly. And with that, all of that comes the requirement that they keep it affordable for 30 years usually. And then of course we need the services. And many of the people that we serve are on Medicaid to get those services, or certainly Medicare. The supportive services and supportive housing, I want to say 1 minute about it. And that is they usually have sometimes have some service coordinators who bring services in from the community for unique things like health screenings, wellness classes, things like that. They may provide transportation, they provide some social service. They do not provide usually help with your daily living activities. Usually it is other kinds of services brought in. Doesn't mean that can't happen, but that is not typical. I want to give you a few ideas of what they could look like and where they could be. They're in every community, really. And seniors, I will say, are the most palatable population for supportive housing. People love to build and help seniors, I guess, because we're all going to be there, as we all are. But other people needed to, so we try to balance that. So here's a project, senior housing in Fairlawn, and it is 85 apartments, and 5 apartments are set aside for homeless veterans. And it's a new construction, and it is, they do have a housing coordinator on site. And all of the apartments, so it's 85 apartments, 5 apartments for homeless veterans, all of them are for seniors. And this is the kind of typical, it's a 3-story apartment building. They have an elevator, they have laundry, they have all of those wonderful things. And the services are coordinated through the county, right? And Care Plus. So that's kind of one example, and it's in Fairlawn, New Jersey, which is Bergen County, right? So this is a project in Edison. You can see that kind of top view. This is 42 apartments for low-income seniors. There are it's actually, I think it's 41 1-bedroom and 1 2-bedroom apartment is what it is. And 11 of those units are set aside for homeless seniors. And those services are coordinated through the Diocese of Metuchen Catholic Charities, right? And then all of these projects are coordinated and have multiple people who work together, the service provider, the developer, and multiple streams of funding that I wasn't going to get, and we're not going to get into. But each of these projects take 3, 4, sometimes 5 streams of funding to build, and they take several years to build. But this is a beautiful and fairly new development and won an Shaw Award last year. And then finally, I want to just show you, before I turn it over to Cassondra, this beautiful, I love this project. It's in Cherry Hill, so Camden County. This is 160 units, 2 buildings, 2 80-unit buildings, a community room in the center, a community building in the center. It's 132 seniors, and the rest are people with intellectual and developmental disabilities. So Jewish Family Services of New Jersey in Camden, they are providing the services for this, and they have a very special outreach, and their work is very specific to seniors, right? They provide senior services to the community outside of this. This is a project that is developed for the first time using land and coordinated through the county of Camden. And it is really quite beautiful. There are 4-unit cottages, sort of like mini group homes in there for the people with developmental disabilities, but the rest are for seniors and independent apartments. And it's a beautiful thing. All of these, again, have services brought in, laundry, security, all that you would imagine an apartment to be, and in a beautiful location. And that's what those are just a few examples, but there are many, many more. Cassondra?
Yeah, so Diane gave you a little bit of background on what supportive housing is and what a couple of really great examples are in New Jersey. And what I want to talk about is being able to add more supportive housing apartments to our communities. So we did a needs assessment for supportive housing for folks who are aging back in the spring of 2020. New Jersey needs a little over 17,000 supportive housing apartments for folks who are aging, which is a bit of an overwhelming number. And so we've been working together on figuring out what are concrete ways to be able to manage and make movement on that. And so earlier this year, we, in collaboration with a number of other organizations, pulled together an advocacy agenda. So I just put a link in the chat to that. It includes a number of recommendations. There's been lots of federal resources that can be leveraged right now. There's a lot of state capital dollars that can be used. And we also had some recommendations around locally, around collaboration, and supporting the workforce. And also in this advocacy agenda are a couple of resources. One is a reframing supportive housing and aging guide. It's essentially a tool you can use in holding conversations with your own community. And Dr. Althea Pestine-Stevens was actually the chair of that subcommittee who pulled that together. And there, we also have an aging in place resource guide, which is designed if you know folks who are lower income, who want to be able to age in place, and gives some resources around that. So next slide, please do click on the link in the chat to be able to dive into that advocacy agenda. And the last thing that I'll leave you with is that there's a lot of different partners in New Jersey who can help think through if your community is thinking about developing affordable housing and maybe including a couple of units to be set aside and to be supportive housing apartments for those who are aging. Diane's Supportive Housing of Association is a really good group to get plugged into, and my organization, CSH, we're a community development financial institution. So we provide early stage lending to be able to help kickstart projects who include supportive housing set-asides. And just wanted to include this side because the development process does take a little bit of time, but it's manageable, and we are here to help your communities think through these. So with that, I think we have about 10-12 minutes for questions. So please either put your thoughts in the chat or come off mute and let us know what you're thinking. Do you have supportive housing apartments in your community? And Jackie.
We do have supportive housing projects in our community. Sometimes we have a number of apartments which I think the groups that have sponsored them have found it's easier to get apartments for supportive housing. They sort of go beneath the radar screen. I know that Diane said that senior housing is generally more acceptable to the not in my backyard people, but our age-friendly initiative, our executive director is planning a new affordable housing project in Teaneck with the support of the town, but it will be privately developed on township land, and the neighbors are not happy. We thought they would love this because many of the neighbors need to downsize. There won't be supportive housing units in that particular project, but because for that project and in general, I'd like to know does it make a difference if there are supportive housing units included in allowing preference for municipalities? Our residents would be so much happier if they knew that they would be able to live in those units. Now, I'll use Teaneck as the problem example. We understand very well why HUD and other regulations do not want that to be used to keep others out of their communities, especially minorities in some communities, frankly. But Teaneck is a community with people of many diverse backgrounds. And this particular affordable housing project is in a very diverse neighborhood with many minorities. And yet we can't say to them, yes, you may have to deal with more traffic. We don't think they'll have more traffic, but whatever their problems are, but you can live here. We can't guarantee that it's going to be a lottery. Is there any way that people have, understood our problem, but said, no, we can't help you because it would be against the law? And yet it seems like we're hurting our own residents who would have to look someplace.
Okay. So there's a lot going on in that question, and it really depends on the type of housing that you're building. If it's a HUD building, that's a different, I didn't talk about HUD buildings, right?
And this isn't,
those are senior buildings that have other things like my own diocese. We have 3 senior buildings we participated in funding back in the day, and they're lovely ones in Rutherford, all over. And many other faith-based communities. It's a really nice partnership, right, with faith-based communities, other communities. So that's a different thing. The supportive housing, we're talking about like these, and I get notices all the time. We put them on our website. I always see preferences for those supportive housing. They'll say something like, preference for those who work or live in Essex or Passaic, or something like that. So it really depends on the units, depends on the funding. But there's always going to be a lottery. You can't guarantee, but you can have some preferences, but it can't be so exclusionary that it's going to exclude a broad amount, because people actually need funding. I don't know if you want to add anything, Cassondra, but I mean, I've seen preferences, but they're usually a little broader than people who live in Teaneck,
Right. It would be the COA region, probably.
Probably, yeah.
Yeah, no, Diane covered it. It's complicated.
Okay, thank you.
I know it would be, but everybody would only want to build for their own,
Right,
place.
but I think in a community that's largely minority, it's different. This isn't a question of trying to keep others out. It's a question of trying to serve these underserved, many of them who are underserved.
Yeah.
But there's no allowance for that.
I'd have to, we can take it offline. We can look at who you've talked to and what kind of building it really is, and who's the funder and where the funding comes from, because it really depends largely on that. But I've seen a lot of preferences and a lot come through, but usually it's a little broader, and it's for people who live or work or, something, because they want to also help people to work in areas where they live, like policemen and, affordable units for people who work in the hospital and things like that. So,
Thank you, Diane. And
yeah.
Cassandra.
Other questions around supportive housing or building new supportive housing for your communities?
Shonda, do you have a question?
No.
Mm.
No, I don't have a question.
I'm surprised, Jackie, about that, that they're not happy. Is it the size of the building? Because sometimes people
No.
think,
I think the fact is that there have been many private developments, expensive developments, where many of these people can afford to live, that have been built in that area of town. And now, we said we're coming along with something that really is geared. It's exclusively senior housing, not supportive units,
right,
but it's exclusively affordable. There'll be a community room on the first floor. And I think we're making a little bit of headway, but there are some leaders who are saying there's enough that's happened in this area. And I know that there'll be one or two people in this, 45 unit or whatever. It's a little more than that, but they're
so,
not.
it also there might be a history there of, they have maxed out their COA credits. They don't need to build any more affordable.
No, they need the
They
COA
need
credits,
the
because
COA
I
credit.
think that if they didn't, we might have a way through the state housing mortgage financing that there could be a preference, but I think the council needs it. So I think people would be delighted to have it if they knew they could be in there. And of course, we're trying to say anybody who needs a home should be welcome here. Once they're here, they're Teaneck residents.
Mhm.
And so but that's not how many of these longtime residents feel. They can't afford their homes anymore. They want to stay in their communities. This is the, perfect location for them. And
Yeah, no, I
something
know.
else to be frustrated about.
Yeah, okay. Yeah, no, it is frustrating. So we should talk about that. Stu, do you have your hand?
Yeah, I just have a point of information. Today at 2:00, the New Jersey Assembly Housing Committee is having public hearings to discuss essentially what the future of COA is. And I think that will, obviously tie into the ability and potential funding to build family housing as well as senior housing. So that's just a point of information. And you could watch the hearings. You could go
About the
online and
fourth
actually
round
watch
of-
the hearings.
Yeah, it's about the fourth round of COA of, looking at affordability in each town. They just finished, sort of
Right.
doing the third round, and, it's been in the courts. So, I mean, that's why you kind of see housing being built, because, there's been a lot of settlements. So the question is, do we go back to having a committee or, a council, but which was blown up, and largely it wasn't done. Basically they couldn't approve the plans. They didn't have the staff. They didn't. So the question is, do we move forward with the fourth round the way it is right now and keep going? Or, is there another way? And I will just say my experience in towns in general is that they fight the affordable housing. So, before they go backwards to something that didn't work, I'd like them to really think through that. Since we've got the momentum going on building the housing, that's just my opinion.
Right.
So where do the two of you see housing going forward? And Stu, that relates to something you just raised. Where do you see the momentum going forward for the state? Is it toward more supportive housing, toward more ALPs, toward more affordable housing for all ages? Where do you see the potential and where do you see some of the roadblocks?
Well, the ALP program is underfunded, and that is a program of services, right? Where you can bring people, those ADL, assisted, daily living support, right? Into housing units. So that would be great if we had more of that, because people could stay in place. And the whole idea is to keep people out of institutions, right? Or anything larger. So sometimes they do need more independent, more services. So I hope the future is to have more of that, because that would allow people to, to stay where they are. So they can move into one of these units like Jackie's describing with a little more independence, but then move into getting the support they need and stay there. So I hope that's where it goes.
Yeah, I mean, I would
there's a-
say, I think, oh, go ahead.
No, go
I
ahead.
guess we're done. I was gonna say, I think there's, so much potential funding coming into the state for housing, whether it's state or federal funding. And some of those funds have time restrictions. And I would like to see the state as a whole get its act together on how to do it and how to fund it and move quickly, because a lot of these federal funds expire, I think, at the end of 2024. So it sounds like a lot of time, but at the same time, it takes a long time to move a housing project from planning to fruition.
I think
So-
that's why they picked with this 305 or 20, million that the governor put aside. They picked projects that were already planning,
Right.
in the planning stage. To your point, and that's just going to last so long anyway, because
Yeah.
it sounds like a lot of money, but
And that money, I think, is specifically targeted to suburban Mount Laurel development. I work
Yes.
in the cities,
yeah,
and right now there's no funding available for an urban project that's over
right.
25 units.
I know, you're right. And we're, the net